My name is Kurt Organista. I'm a professor of social welfare, and I am interested in Latino psychosocial and health problems and their solutions. And then more specifically, I do research on HIV prevention in Latino communities. You know, I'm a psychologist by training, clinical psychologist. I've always been interested in Latino mental health. And in fact, the first line of research that I did as a junior professor here at Berkeley many years ago was on the treatment of depression in Latino populations, particularly immigrant groups, because they come and for some reason their levels of depression and anxiety start going up. And then our School of Social Work, when I first got here back in the early 90s, they had this exchange program with Mexico. It was called the Intercambio program, where we would take our social work students and also some public health students to Mexico, to the Universidad de Guadalajara. And we would hang out with our colleagues and, talk about how to treat people in terms of social work services. And they were very interested in those days in HIV because a lot of migrant workers were coming back to Guadalajara, other parts of Mexico, sometimes with HIV. So I said, okay, let's research it. So way back in the 90s, me and my Mexican colegas began to do some HIV risk surveys. And that actually started a couple of decades of research in this area. Today, I've done more work with jornaleros or day laborers here in Berkeley and in San Francisco. This is a book that's called Solving Latino Psychosocial and Health Problems, Theory, Research, Practice. So in terms of these days, I'm really excited to be in the middle of doing the second edition of this book. I published this book back in 2007, and that was a long time ago. There's been so much research that has been happening for Latinos. So I'm trying to read it all. I'm happy to try and synthesize it and offer it up in a way that's helpful for practitioners. I really enjoy teaching because good teaching, the kind where students actually learn something and are engaged and appreciate it, it's hard to do. It's tricky. You have to keep changing it up and kind of being open, to things. And so teaching is great. I also get to do a lot of mentoring. Like I have doctoral students who come and they want to study about Latino health and mental health or immigration rights. And so I love working with those kinds of students. We're also required to do a lot of service, which fits our Latino culture, right? We always say para servirte, to serve you, right? So I'm on a lot of committees here in social work and on campus and also outside in the communities. And then of course, this is Berkeley, so there's a lot of demand that we do a lot of research in writing. And that's something I've really come to enjoy over the decades. But when you get to do all those things, I think to me, that's exciting. I would tell all the students to just lean into your life, be engaged with your life. If you're at Berkeley, take these classes, get to know your professors and all the wonderful staff that's here to support you and your fellow students. And I would also include with that to take good care of yourself. We're more than just professors or students, we're people. And even when there's challenges and traumas, because very few of us can escape that, just also remember that those challenges, help us to build resilience. They kind of define who we are at times. And so it's important to do your best with those and use all the resources around you to be your best. And so I guess that would be my consejo, my advice. And it's really not any different than I would advise myself or anybody that I know and care about.